Earlier in slide number 2, we addressed some of the common iatrogenic problems among hospitalized older adults, and we identified adverse drug events as being the number one type of iatrogenic problem among hospitalized older adults. Here we have a list that includes some of the different types of adverse drug events that exist. The first one is the incorrect medication dosage that results in an adverse patient outcome. Older adult patients typically need lower doses of medications to help prevent adverse drug events. Adverse drug reactions is another type of iatrogenic adverse drug event that occurs among hospitalized older adults. The inappropriate prescribing of high-risk medications to older adults is another type of adverse drug event. And then medication administration errors fall under this category as well. Now, we've been able to identify some drugs that are associated more commonly with adverse drug events, and they include your antiplatelet medications, diuretics, and anticoagulants. And the dosing and the monitoring of the appropriate dosing are what cause the problems with these particular medications. An example of an antiplatelet medication would be clopidogrel or persantine, and examples of anticoagulants would include heparin and warfarin. These medications, when older adults are on them, require very astute monitoring of the dosaging and the monitoring of the efficacy of these meds to prevent ADEs. Okay. What is an ADR? An ADR, or adverse drug reaction, is any unintended negative toxic response to a medication. ADRs are a significant cause of hospital admissions, and polypharmacy and having multiple healthcare providers who are prescribing medications are key factors in ADRs with the older adults. Another issue is that ADRs are often difficult to identify in older adults because they are often presenting with atypical symptoms such as confusion, falls, lethargy, constipation, and depression. So what is the role of the nurse in the prevention of adverse drug events? Number one, be aware of polypharmacy. Screen your patient carefully for all of the medications, vitamins, herbal remedies, folk remedies, etc. that they take. The brown bag method is considered the best method of determining what your patients are actually taking and how much of it and when, etc. You need to really do a good job right up front. Do frequent medication reconciliations. A med reconciliation is, again, it's an analysis and a study of what medications patients are taking. Do this on admission. Do this when your patients are transferred to a different facility. Do this on discharge to make sure your patient is sent home with a current and accurate list of appropriately prescribed medications. The nurse needs to screen patients' medications for sorry about that. The nurse needs to screen the patient's medication list for those medications that are identified as being potentially inappropriate. It doesn't necessarily mean that the benefits the patient is receiving from those potentially problematic meds, it doesn't necessarily mean that the benefits are going to not outweigh the risks. So it might be okay for your patient to be on those meds, but the nurse needs to be aware that they are potentially high-risk meds and carefully monitor the individual patient. Again, monitoring for adverse side effects. Know the common side effects for your medications that patients are on. List them on your worksheet and monitor your patient for these adverse effects while they are under your care. If your patient develops new symptoms, think about whether or not they've been put on a new medication. If so, there's an extremely high likelihood that the new symptom is a result of the new medication. Carefully examine this as a possibility. Make sure that your patient is on an age-appropriate dose. Older adults, more typically than not, require lower doses of medications than their younger adult counterparts. When older adults are put on new medications, make sure that the dosage is low and that increasing increments are done in very slow fashion. The saying, start low and go slow, has lots of merit here. Make sure you're monitoring appropriate lab values for your patient. Make sure you're monitoring that those drugs are being excreted properly. Know how they're excreted. If individuals have impairment in renal functioning, which is not uncommon in the older adult, make sure you're monitoring the appropriate lab values. If those lab values aren't being drawn or assessed on a regular basis, talk to your healthcare provider. Speak up. Let them know you're concerned about your ability to monitor how safely your patient is responding to these meds, and that you need to have specific lab values ordered. Watch for drug-to-drug interactions, again, including over-the-counter herbal remedies, vitamins, etc. Okay, make sure you assess your patient for nicotine use, alcohol use, recreational drug use, and folk remedies. You need to know what else your patient is using in the home environment so that you can feel confident when you send them home that the medication regimen is a safe one. Attempt to treat new symptoms non-pharmacologically at first. If you have a hospitalized individual who begins to show signs of agitation, before you seek a chemical restraint, try to use other calming methods to help decrease that individual's agitation. Try to find out the source of it. Is it a source? Are they frustrated because we're not communicating well with them? Attempt to treat new symptoms non-pharmacologically first, always. Carefully monitor problems when high-risk meds are used. Again, be aware of those meds that are considered high risk and monitor your patient for potential problems. Collaborate with the interdisciplinary team. In dialogue with the pharmacy, dialogue with the physician or other healthcare provider. Make sure you're all aware of what's going on, how your patient's responding to certain medications, so that the whole team can appropriately monitor the medication regimen for the older adult. Insist on physicians entering their medication orders in the computer system if such a system is available. We know that computerized medication orders reduce the risk of errors that are a result of transcription of orders. Keep your eyes open for the following drug classifications: anticholinergic, benzodiazepines, antipsychotics, sedatives and hypnotics, NSAIDs, opioids, corticosteroids, and tricarboxylic acid. All of these classifications of medications are high-risk categories for the older adult. You will come across older adults who are on these medications in these classifications, but be aware that they are high risk and carefully monitor your patients. Do your part to reduce the frequency of readmissions that are related to adverse drug events. Make sure that you implement excellent discharge education and counseling. Assess your older adult patient for memory problems or depressive symptoms that might interfere with the safety of a particular medication regimen at home. Assess the older adult's functional abilities. Are they going to be able to open up vials, tubes of medications, administer self-injections? Are they going to be able to do that at home, or do you need to consider alternative devices to help that individual accommodate for functional disabilities? Assess the individual's health literacy. Try to find out whether the older adult understands what the drug is going to be used for, how often it's to be taken, what to do if a dosage is missed, what kinds of side effects to be on the lookout for, what to do if they experience those side effects. When at all possible, go over all discharge instructions with the care provider, with a spouse, so that there are two sets of eyes, two sets of ears listening to the instructions. When at all possible, send individuals home with written instructions. The tendency is to forget. There's a lot going on at discharge. Make sure instructions are written and written clearly at a level the individual can understand. Assess the individual's beliefs and concerns regarding their medication regimen. Find out, does the individual really believe that these medications are helpful, or are they demonstrating by what they say the tendency to perhaps not follow through with the medication regimen once discharged? Being aware of these tendencies before the individual is discharged can put the nurse on alert and help the nurse communicate better with the individual older adult in terms of the value and the importance of following the medication regimen. Discuss with your patient the impact of the cost of medications. If necessary, make sure that that individual patient has a good conversation with social services prior to discharge, so that the individual is connected to appropriate social service resources available in the community that might assist especially the low-income older adult, obtain and continue to obtain expensive medications. This concludes my presentation of chapters 12 and 17, and during class on week 2 we will go through a case study and apply some of these concepts. So as you have been listening, I hope you're jotting down questions, and bring your questions to class as well, and we will move forward with week 2 content.